Hi, it's Dr. Kyle talking to you today about one of the complications that came out of our society's response to COVID, not just here in the US, but actually worldwide. And that is that a lot of people were told to stay away from their primary care physicians for procedures or appointments that were deemed not necessary. Now, not necessary doesn't mean that they weren't important, but at the time, what it meant was that they weren't life threatening. And by doing that, they were hoping, of course, to flatten the curve, as they labeled it at first, to keep the load off of those hospitals or those surgical facilities, to make sure that the people that quote unquote needed the surgeries for life-saving interventions the most got those. But what's happened over the last couple of months is because those surgeries that were deemed not medically life-saving at the time were put off, they're actually looking at a backlog now of not just months, but possibly a year or more before we get back up to the same number of surgeries and procedures that were being done previously, before the beginning of this COVID outbreak. So what that pertains to today specifically that I want to talk about is just how much that's affected people in our own community here in the Rockford or the greater state line area, but also what can be done to help those patients. There's a good chance that maybe you or someone that you know is affected by this delay, and it's looking like it could be months or even a year or more before they get the opportunity to have the surgery that they've been told was necessary during that time. Now, first and foremost, for a small percentage of those people, the time off is going to allow their body to heal and function, and they may actually be able to avoid surgery altogether, and that would be great, of course, and that's what we hope for everybody. But for a lot of people, unfortunately, what it means is that while they're sitting at home not having the procedure or the surgery, they have to turn to things like pain medications or other destructive things just to cover it up, just to function until how to get back. This is the perfect opportunity to help somebody, or if it's you yourself, get back in and see if a chiropractor and a chiropractic adjustment on that joint, on that spine, on whatever it is, can actually help your body heal and function to a much higher level. To just go by the numbers, every week that we're under this reduction in services in the medical industry, an estimated 30 to 50,000 surgeries are postponed over the entire course of the next 4 to 5 months. So looking at about a 7 to 8 month period, it's estimated that we're going to be looking at, as a society, over 1 million surgeries are not going to be performed. And that's everything from hips and knees all the way up to spinal surgeries. So there's so much opportunity for people that are suffering or in pain or not able to function highly to look for other alternatives rather than turning to a pill or a potion to do so. If you or someone you know that you care about is suffering at home because they're told that they can't have the procedure done, I would encourage you to be evaluated by a chiropractor, whether it's here in our office or one that you trust that's local to you or close by. Please encourage them to be evaluated by a natural health practitioner to see if there's something that can help, whether it's just increasing their quality of life over the next several months until the procedure is done, or possibly healing to the point where that procedure can be either delayed or held off completely. We see it in our office all the time, and we're actually seeing a huge influx of these types of patients coming in from their family members. This is the perfect opportunity to talk to them and say, hey, this is an opportunity to get in and see if this would help. Low risk, and it really only benefits from there. So keep that in mind. As surgeries have been delayed, as procedures have been delayed, if you hear somebody talking about that, please encourage them. There is hope. There is help. The body can heal. We're here to help facilitate that by making sure it's functioning at its high level. Have a wonderful day. I can't wait to see you again soon.